Good morning friends, welcome back to my YouTube channel Medical Classes by Dr. Shiro Acharya. Please don't forget to subscribe to my channel and also please give your valuable comments. You can also visit the playlist. In the playlist I have provided almost all the topics in a very systematic order and this is quite convenient for the continuous study. I hope you will make use of it. Thank you very much. My dear friends, we have been discussing about challenges in administration of Ayurveda medications in children, and we have been also looking into some of the solutions for that. And today we will discuss about the continued portion of the Bayha chikitsa in children. In the last class also we have seen so many abhyanga procedures done generalized way or in a local way, how it is very beneficial. So one more Bayha chikitsa which is commonly practiced in childhood practice is Shiro Pichu. Now, as we know, Shiro Pichu is alternative to Shiro Dhara. Shiro Dhara is mentioned, Shiro Basti is mentioned. Okay, so similarly there is Shiro Pichu also. Now, basically the problem is Shiro Dhara is quite difficult to administer in children because we have to maintain certain position. Okay, child has to be there in the cool and calm position for a longer time, which is quite impossible for the kid, especially if the kid is autistic, ADHD, and mental retardation, CP, etc. The maintaining that particular position for a longer time of 30 minutes, etc., is quite impossible. And in the meantime, many times when you keep the baby or child in that position, baby used to cry, and if the baby start crying, then Shirodhara has got no any meaning. So therefore, we have an alternative for Shirodhara, that is in the form of the Shiro Pichu or maybe sometimes Shiro Lepa. Now talking about the Shiro Pichu, this is quite useful in degenerative disorders of the neurological system, nervous system and other parts of the body, and even some of the cognitive disorders of the brain. Now it is believed that Shirodhara work on parasympathetic nerve system by inducing the sleep. Parasympathetic nerve system is that system which cools down your body and your mind. Okay, it is exactly opposite to that of the sympathetic system. So this is a cholinergic pathway, cholinergic system. So cholinergic system is related with the digestion, excretion and as well as sleep. So when I say cholinergic system, so this helps to cool down the mind. That means the aggression, excitation, what we say Vataja symptoms or Raja symptoms will be controlled by this type of Shiro Pichu. Now basically we know that there will be Raja and Tama as two main doshas of the mind. Any excitatory movement or over movement or uncontrolled movement which is existing in the body is nothing but the Raja guna of the mind, maybe psychologically, physically. And similarly the reduced activity or decreased activity, dullness, laziness, so that can be compared with the Tama. Now here in those disorders where there is increased excitatory movements, so we have to go for Shiro Pichu, which is quite beneficial. In other words to say, it stabilizes the sympathetic and parasympathetic nerve system both. Now sympathetic and parasympathetic nerve system, the balance has been get disturbed, and by calming down the that means calming down the sympathetic system and increasing the parasympathetic system activities, so it induces the normalcy. Anyway, now usually if you go for Shiro Pichu, it should be done after Mundana Karma. First you have to go for the Mundana and then you have to go for Shiro Pichu or Shiro Lepa or Shiro Dhara. In some cases even Shiro Dhara can be also practicable, no problem, but in general what we are telling, it is quite difficult. So after giving the Mundana, if you practice, this gives a very good result because the oil will be directly absorbed to the skin of the scalp area. Otherwise the oil will be soaking the hairs and may not be completely absorbed. Now Shiro Pichu can be substituted by Shiro Lepa. Shiro Lepa also can be, so many Medhya drugs can be taken with their Medhya Taila or Medhya Gritas. It will be mixed, or it can be even mixed with the butter, and then it is applied over the Murdhini Pradesha, so that is quite beneficial. The area which has been mentioned as Murdhini Pradesha will corresponds to the area of what we say the anterior frontal. roughly. Now Shiro Lepa, so many major drugs with the cognitive properties can be taken, and Shiro Lepa of the major drugs in cognitive disorders is quite useful. Similarly, Shiro Lepa of some other drugs can be done in case of some of the fungal infections, and fungal infections related to the skin, especially scalp skin. Now, one benefit of Shiro Lepa or Shiro Abhyanga, so that is in case of neurological disorders, where we are aiming to correct the parasympathetic nervous system activities. Suppose if the child is suffering from seborrheic dermatitis like condition, there also we can go for the Shiro Abhyanga, but Shiro Abhyanga, the oil will be different. Either you can go for Mahamarichadi Taila or Dardurapatradi Taila, or even some of the other local wounds of the scalp, also we can go for some of the other Tailas. Shiro Abhyanga can be even practiced in case of premature graying of the hair. Okay, the oil should be very specific, Neela Bringamalaki Taila or some other the Tailas which is beneficial for the hair. The Twacha and Kesha drugs has to be taken. Shiro Lepa with Tikshna and Ushna drugs. Now, Shiro Lepa can be also done by using Tikshna and Ushna drugs. For example, you can take Vacha, you can take Jatamamsi, Pippali, etc. And this has to be mixed with the Gomutra after doing the Mundana. First you have to go for Mundana, then you have to do the Shiro Lepa by using these drugs, by mixing with the Gomutra. And this is quite beneficial in case of autism. Okay, in autism actually sensory block is there. So we need to remove that particular sensory block. So therefore we have to go for Tikshna and Ushna drugs, and that is quite beneficial in case of autism. Similarly, if you go for Shiro Lepa in case of ADHD, where typically Vata Vruddhi Lakshanat will be there, or Vata Prakopa Lakshanat will be seen. Exaggerated Vata, Raja is get excited, Raja is more. In that condition, you have to go for Kapha Hara medicines. So Shitha, Madura and Snigdha Dravyas should be used. So any particular Taila which is having this particular property can be used, starting from Yashti Madhu, Kshirabala Taila, etc. Even Shiro Lepa can be done with the Majjas. Okay, for example, Vibhithiki Majja is there, Aragvada Phalamajja is there, Ballataka Phalamajja is there. So Shiro Lepa can be even done by using the Majja of various drugs, or even the animal product like the goat, etc. Majja. So that is quite beneficial in case of cortical atrophy. Any condition where the MRI scanning shows that there is a cortical atrophy, brain parenchyma itself is less developed or diminished. So Majjam Majjena Vardate, that is the principle, and Shirogata Majja is nothing but Mastishka. So in order to increase the Mastishka, even you can go for the Majja preparation. So this is one more important point. Similarly, Shiro Lepa, now Mukha Lepa coming down, that is Mukha Lepa. So Mukha Lepa can be also useful in many conditions. For example, Eladi Gana Lepa is mentioned, Yashti Madhu and Amalaki Lepa is there. So these are quite good for the Padmini Kantaka or pimples, etc., or some other atypical skin lesions related to the Mukha. Lepa or oozing skin patch. Now suppose if there is a skin patch, maybe inflammatory patch or whatever, there's a oozing, and you want a localization of the lesion. The lesion is spreading, for maybe cellulitis or something like conditions. Lesion is spreading around, and you want to limit the spreading. You have to localize it. So then actually a thick Lepa of Dashanga Lepa is very, very beneficial. Similarly, Lepa can be also done over the dry skin patch. Okay, if the dry means it is Vata Vruddhi Lakshana, so therefore now for the dry patch you have to go for Lepa with that drugs or oil mixed with some of the drugs which are having Madura, Snigdha, Rasas. Manjishtadi Lepa is very preferred, especially for the reddish patch and also some of the peripheral vascular disorders. Manjishtadi Lepa is quite beneficial. Similarly, Lepa in case of macules, Shitra, also we will apply the Lepas. And Lepa in case of streptococcal and atypical bacterial infections can be done by using the Amashodaka, that is Amapachana drugs. Okay, Amapachana drugs. So they are quite beneficial. Then Pattabandhana is one more method. It is just a modification of the Lepa itself, or Upanaha Sweda, you can say. It can be modified form of the Upanaha Sweda, or even it can be considered as a Lepa also. So again, Patta Bandhana is quite useful for the deformities or some of the contractures, etc., or if the contractures are developing, or if the spasticity is more, as in case of cerebral palsy, etc. So Lepa with the Vatahara drugs can be done. So this is how again the Bahya chikitsa is helpful in children in so many conditions. Instead of trying in oral administration of the drugs, many times the Bahya chikitsa gives a very good result. So rest of the things we will discuss in the next class. Thank you very much.